sperm testing and abstinence days. In this video, we are going to look at what is the recommended period of abstinence or the gap that you must give between taking the test as well as having sexual intercourse with your partner. The WHO 2010 manual as well as the previous version of the World Health Organization Andrology Laboratory Guideline manuals, right, have recommended 2 to 7 days period of abstinence. So generally when a male goes to a fertility clinic, the recommended period of abstinence is 2 to 7 days. But there's a very important problem here, and recent studies have actually pointed this out very classically. So what's happened here is, with a longer duration of abstinence, when a male goes to the clinic and gives a sperm sample for testing, the stored spermatozoa come out, right? Because the sperm storage capacity of men is usually somewhere between 4 days to 7 days. The sperms get stored in a structure called the epididymis, which is above the testis. That's the site of sperm storage. But remember, it's a transient storage system. It can store anywhere from, say, about 2 days to maybe about 5 days. That's about it. So the spores, when sperms are stored there, a lot of DNA damage happens to the sperm. And then when you go with a 2-day or a 4-day abstinence, like you're having intercourse with your wife today, after 4 days you're going to a fertility center, you're giving a semen sample there, what's going to happen is you're probably going to see the stored spermatozoa, the parameters of the stored sperm there. And what happens is, in the report, you will notice low motility and low morphology in your semen report or sperm report. You may not get normal findings for your motility parameters as well as your morphology parameters. And to prevent this, what we generally recommend to all our patients in our clinic, and what we've done for the last 10 years, is standardize the period of abstinence to 1 day. And that is in line with newer published studies from Oxford and a lot of other prominent places. So with a shorter duration of abstinence, there's 24 hours or 48 hours, or even, for some patients, they can have contact today, the next day they can come and give the semen sample. Patients tend to get reports that are more accurate. So the sperm motility and the sperm morphology are more accurate, and they are close to what should be normal. Now, with a longer duration of abstinence, the biggest issue we see is patients have low progressive motility, even though the semen volume is high. Percentage of moving sperm is less. Sperms with normal shapes are less. And then what happens is, ultimately we are treating the patient for a disease condition they don't even have. And that becomes a problem, because then you don't know which patient is fertile or which patient actually has subfertility. So standardize the day. So if your doctor is asking you to do a semen test, even if the doctor says you need 2 days to 7 days gap and things okay, no. You bear in mind that you have to have sexual intercourse with your partner or wife today. Give a 24-hour gap and then do the semen test. And only that report you are supposed to believe. Hope you liked the video. Drop in your comments below. Subscribe to the channel. I'll see you soon with other videos. This is Dr. Shah signing off for now.